Good evening. These are difficult days and they may get much more difficult yet. So many of you have contacted us expressing genuine fear and anxiety, and we hope that by getting answers to as many of your questions as possible tonight, we can all avoid unnecessary panic. We're going to prioritise information and expertise over opinion and argument, but we will also test some of the big decisions that are being made. Like you, we're adapting. Social distancing in the studio, changing the way that we live, work and interact. But to be clear, for as long as this takes, we'll make sure that your voice is heard. You've got the questions, in fact, the most questions we've ever received. So let's get you some answers. Welcome to Q&A.
There is so much misinformation at the moment, which is creating panic.
Why won't the government do more in its messaging and policies to ensure that people are practising strict social distancing?
Shouldn't anyone with symptoms be able to get a test right now?
There are many homeless people across Australia. I'm one of them. How do we self-isolate?
If we go into a lockdown, I will have no form of income.
How does one afford to comply with self-isolation if their financial situation simply doesn't allow for it?
What will happen for students in less advantaged areas who may not have a stable Wi-Fi network or computer?
I have a physical disability. I use a wheelchair full-time and I have compromised lung function. I'm at significant risk if I get COVID-19.
Are we headed towards the kind of scenes that we're seeing in Italy, where doctors are having to choose between who to give intensive care to and who to simply leave to die?
Good evening, welcome to the program. Joining us tonight, he started his career as an apprentice chippy. He's now the Minister for Aged Care, Youth and Sport. Would you please welcome Richard Colbeck? Also, Shadow Minister for Finance, Katy Gallagher, who's familiar with pandemic planning from her time as the Health and Chief Minister in the ACT. GP and former AMA President, Dr Mukesh Haikerwal. He's been running pop-up drive-through testing clinics in Melbourne. And reflecting current circumstances, two of our panellists tonight are elsewhere. She sits on the board of a number of companies, including the Sydney Swans, Sam Mostyn, who's adhering to a company-imposed travel ban tonight. And leading infection control expert Bill Bowtell, who is currently in self-isolation after being in contact with someone who has tested positive to coronavirus. And in the studio tonight, well, this is what social distancing looks like. Not the usual 200 or 300 people. Instead, a few individuals who will ask some of tonight's questions. They're all at least 1.5 metres away from each other, which is following the protocols. You can stream us on iView and YouTube. Join in on Facebook, Twitter and the Gram. Quanda is the hashtag, and because of the intense interest in tonight's topic, we will keep an eye on the socials for any questions that pop up during the program as well. Well, let's begin tonight with our first question, and it comes from Lorianne Sharp.
My question is for Senator Colbeck. Tragically, we've seen 3 residents die in nursing homes from COVID-19 recently. We know that the elderly are much more vulnerable and have comorbidities and are likely to suffer death if in contact with COVID-19. What is the government doing to stop non-essential visits to nursing home to prevent the spread of the virus and ultimately further deaths?
Senator.
Thanks, and a very pertinent question given that we put some advice out over the weekend and today to the aged care sector to ensure that their infection control plans were properly in place, but also to limit access to aged care facilities. You're right, we know that that older Australians are more susceptible to this disease, to COVID-19, and so there was some considerable advice that was provided from the Infectious Diseases Network meeting that occurred last week, put out to the industry and confirmed in a release that I put out today.
Can we be clear, though, about what it means? Because you've said that residential aged care providers will be encouraged to limit visits from today. What does that mean in practice?
So there is comprehensive advice, about 48 pages of it, that goes with that release that I put out today. There will be some more information, I think, that comes out of some of the deliberations that are going on over today and tomorrow through the AHPPC. Because we understand quite clearly that senior Australians are more susceptible. People in nursing homes are there because they've got a range of comorbidities. They are clearly susceptible, and the circumstance that we have at the moment, unfortunately, is that where an aged care worker went to work not knowing that she had COVID-19 and that's been transmitted to 3 residents. It demonstrates the risk. We've learnt a lot from that process too.
I just need to be clear though, because there's lots of people watching tonight.
Hamish, may I come in here, please?
Well, I just need some clarity though on what people who have family members in aged care facilities can do and cannot do.
Well, so some of the things include, and I know that some facilities have been doing this anyway. So who's coming in? What are their risk factors? Have they, do they have an illness? People who don't need to be there don't come in. Limit your visits. So a range of things, and there's extensive advice that's been published today to provide and sent out to the sector so that they can ensure that they have those things in place. And as I said, the AHPPC is currently meeting, and if there's any additional advice that they need, we'll be forwarding that to the sector as well. So it's actually limiting access to those people who need to be there for certain reasons and saying to others, don't come in if you don't need to.
Bill Bowtell, is that clear enough?
Hamish, I wonder, I'd like to ask the Minister, where are you getting this idea that older Australians are more vulnerable than anybody else? On the figures released tonight in New South Wales, almost 80% of the caseload in New South Wales, which we're assured by Brad Hazzard is going up exponentially, 80% of them are younger than 60. Well, where are you getting the information that older Australians at the moment, at least in New South Wales figures, are more vulnerable?
Well, if you look at the numbers of people who have passed away so far, they are all over 60. So I'm talking about the mortalities, and so that's the issue that we're looking at. So in the context of mortalities, clearly the people who are more susceptible to the disease in that sense are senior Australians. That's the advice that comes to me from the CMO and others that I talk to. Clearly,
yes,
people across the age cohort...
I wonder if that advice might be published.
Well, that's the advice that comes to me. That's the advice that's been put out by the CMO every time he speaks.
Web, Senator Colbeck?
I'm happy to provide those numbers. I mean, I don't see any reason why that information shouldn't be put there. Now, I'm not saying that this is who doesn't get the disease. I'm saying that in the context of who the disease has the greatest effect on, in the terms of illness and mortality, it's clearly people over 60, and that's the advice that I've been given.
Okay, let's take our next question.
Well, I'm afraid in France tonight, people of all ages, not just old people, are contracting the disease. I feel very sorry, and I've expressed my condolences to the 5 people who have died. I feel very sorry for the people in Australia who have contracted this disease.
Bill, I think we're talking two different things.
I'm not that you have the advice you require to go on.
I think we're talking about 2 different things.
This lazy assumption.
I think we're talking about 2 different things.
We're
not talking about who contracts it. I'm talking about the impact on them when they do contract it. So clearly, it has a greater impact in the context of mortality for people over 60. I'm not saying that other people don't contract it, because that's, I'm not disagreeing with you at all there. Other people do contract it, but I'm talking about the impact on them when they do. The impact is clearly greater for people over 60, and that's why we're taking the measures that we are to protect particularly people in aged care.
All right, let's take our next question tonight from Dr. Pip Wills.
We've seen the abuse to retail staff because of issues like toilet paper. How much abuse will I get when I, as an emergency physician, have to say, no, your loved one will die. There is no ventilator. There is no bed. They could have been saved, maybe, if we had the resources, but we don't. How are we going to protect our frontline staff, like me, from the abuse that we will get?
Dr. Mukesh Haikerwal, your frontline staff, is this the reality?
Unfortunately, yes, it is reality. One of my colleagues has just opened up a fascinating clinic on the Sunshine Coast, which is funded by the federal government. It's one of the first tranches that's been put out, where the clinic has actually got a centre just doing tests for COVID, and he's actually had to put on a security guard to reduce the rates of violence that otherwise he might get in there. And luckily it's settled things down. In hospitals, we know it's a problem. We've seen that problem in this state, in Victoria, and unfortunately other states across the country where frontline staff are under attack. We've seen legislation have been passed to reduce that level of violence on people in that sector, and certainly my colleagues in the emergency department see the heat of this every single day and every single night that they work there.
I've read a speech that you made in December 2005, Mukesh, at the Pandemic Influenza Primary Care Forum. And you warned back then about some of the very circumstances that Australia is now facing. You talked about the need for pop-up clinics. You talked about the need for adaptability. Given that you've been warning about this for so long, are you surprised at this situation Australia now finds itself in terms of preparedness?
It is something that we are where we are and we've got to move on from it. If we look to the past, yes, I was there for bird flu, and I think Katy Gallagher was part of that as a state territory health minister at the time. We then went on to swine flu. We had the SARS come through. You know, the health department set up the Office of Health Protection, and things were going really swimmingly. I don't know what's happened, but we are where we are. We've got really good coming together now.
But we have 2,000 ICU beds in Australia. Is that enough?
Definitely. No, totally. So the whole issue is that if we don't go to the measures that we're seeing tonight, if we don't get the message out about washing people's hands, about keeping good hygiene, about self-isolating when people have been asked to, we will continue to see this spike of people getting COVID, and therefore the demand will be massive. So the idea is trying to reduce that demand by having these measures that reduce the transmissibility in our community. And so, no, we don't have enough. If we get the spike, if we do this right, we can potentially ride the wave.
Bill Bowtell, the question there from Dr. Wills, though, refers to a reality about community expectation. Do you think that the government at a national level needs to be open and transparent about what we're facing in terms of the number of people that might be impacted by this?
Yes, we need honesty and truth and transparency, all of which has been in remarkably short supply in the long and lamentable history of the failure to do this.
Wouldn't that create panic, though? That's the concern. That's the concern, that they would create panic.
The panic is out there. Have you been to the supermarket shelves? Have you seen the security guards who have to allocate and ration toilet paper and every other thing that's no longer on the shelves in Sydney and Melbourne? The panic is there because the lies and the misinformation have been circulating in the Australian community for weeks and weeks and weeks. Now, the answer to panic and misinformation is truth and honesty. We need to know, for example, tonight from Senator Colbeck or Minister Hunt, who is not here, or the Prime Minister, who is not here, the answer to one question. How many test kits are there tonight in Australia? And under what circumstances and to whom will they be rationed? The Premier of New South Wales said today that there were very few test kits left in regions of New South Wales, and on the Friday the 13th, an appropriate day, Professor Murphy said there were some regions of Australia with no test kits. Where are those regions? How many are there? And what are the rules and conditions under which they will be distributed until, as I see tonight, a panic buying of testing kits and so on is to be flown in by Roche Pharmaceuticals? I would like to know those numbers. There is no reason they should be kept secret or hidden, and I'd like to ask Senator Colbeck now, as a health portfolio minister, how many test kits are there tonight in Australia?
Before we go to the Minister, Katy Gallagher, is it fair to make the government answer such questions at a time where there is so little certainty?
Well, absolutely, we're in unprecedented times. I think everyone in the country acknowledges that, but I think certainly Bill has a point. I think access to information and clarity of information and consistency of information is key to ensuring confidence and trust across the community. And there's certainly, when you're out and about and you're talking with people, that's not a sense you pick up across the community. There is high levels of anxiety, high levels of panic. different interpretations of information. You know, the public information campaign's taken a long time to get together, and there's some views about whether it's effective or not enough already. So, look, I think the government has a couple of jobs to do here. One is to make sure that the health response is adequate, timely, and meets the needs of the community. Show leadership and give a sense of we've got this to the community as well as dealing with some of the economic challenges that are flowing out from this health crisis. So there's a lot there, I acknowledge that, but that's what we elect governments to do. They've got to lead on this sort of stuff.
So, Senator, can you answer those questions that Bill is putting?
I can't tell Bill tonight how many test kits there are available. It is public knowledge, though, that there is a shortage of some of the chemicals that go to making those up. And that's one of the reasons that we've said, and we've said this publicly too, is we want the people who have the prerequisites for being tested to be the ones that get tested. We were talking earlier tonight about the worried well, who might have a tickle in their throat, they might have a headache, they might have a cough, but they don't have the prerequisites for being tested, and yet they're turning up at the clinics that Mukesh was talking about
worried,
to get tested because they're worried.
Yeah.
And that goes to some of the other misinformation that's being put around in the community. And we need to make sure that the messages come from a single source of truth, and that's what we're attempting to do. We're trying to, and that's why we've had Professor Murphy.
Does it help when the federal government won't say what the projections are in terms of the number of people they project could be impacted by this?
Well, the problem with that is that in the context of projections, you're going to have a range of numbers.
Sure. But the states are doing this without creating mass panic.
Well, I think the different messages coming out, which is why the Prime Minister's formed the National Cabinet, so that there can be one message, and I think that was a great move that the Premiers and the Prime Minister made last week, so that we can get one message, so that the states aren't putting different information out there.
But they are. The Victorian Chief Health Officer today said on ABC Radio that modelling shows between 20 to 70% of the population will contract COVID-19. The New South Wales Chief Medical Officer has told budget estimates that as many as 1.5 million people in New South Wales could contract the coronavirus. There is not a single message, there are multiple messages. Why don't you put out a simple single message at a national level which states clearly to the public, this is what the projections are?
So there's a range of numbers in each of those circumstances, up to. And I think that's what's contributing to the change. And of course, the media generally latches onto the top end number. We actually, all of the actions that we've taken to date have been to try and slow down the growth of the virus within the country so that we can...
Rubbish.
Hamish,
well,
can I offer a
Bill, I think that's unfair to say, because we moved early with respect to restrictions on travel. We were criticised from
You moved late.
We moved before nearly anyone in the world, and I think the situation that we're in now, with the growth in the sector, with the growth in the rate of spread, has put us is because we moved early, and I think that has made a real difference, and it's all designed to try and help our health system manage it. Because, as you've said, 2,000
Richard, with all due respect, you are speaking like a politician.
I am a politician, Bill, and I don't apologise for it. But I'm trying to provide clear information to the community.
Well, on behalf of the Australian people, I think you ought to, because you should not be here. The Prime Minister or the Minister for Health ought to be here to be held accountable. You are not ahead of the curve. The Minister for Health in New South Wales today said we are facing exponential growth. The hospitals can't cope with that. The people can't cope with that. You've had 10 since the beginning of January to do this. When the situation got serious in Taiwan, they created a national unified command, I think on January the 20th, 8 weeks ago. Nothing like that was done here. There was no public education campaign. There was no mobilisation of the people. The state governments did not sanitise and disinfect the transport systems. And people would go around saying that as recently as on Friday, your Prime Minister was saying, no, nothing to see here, social distancing next week, everybody go out and it's not a problem. On Friday, the Prime Minister said bans on meetings of 500, but not on Friday, on Monday. Today, the United States said 50. In Austria, it's 5. Have you not looked at the calamity that's overtaken Italy and France and Denmark and Austria? And the success
and those
of
things
Taiwan,
happened because
South Korea and Singapore?
And those things happened because they took no action.
Have you not looked at it?
We have taken action, Bill. We have taken action.
What action did you take?
And
where?
Can I just interrupt at this point? So we are here to answer as many audience questions as possible. Sam Mostyn, I know you're trying to get in.
Yes.
Thanks, Hamish. I was just going to suggest that at a time like this, obviously emotions are running high. The community also has its own concerns about where its single point of truth is. And I find it really interesting that in the business world that I spend most of my time, there's been a clear set of protocols put in place, listening to the best advice from around the world. And so the reason I can't join you in the studio tonight is that all my boards and companies have put a ban on any unnecessary travel, on any meetings with people where it puts us at any risk of transmission. But we've all had to come to some understanding about what are the disciplines and the rule-based system that we've moved into. And in that context, coming into this panel tonight, I've been approached by so many people around the community, heads of ED departments, people working in aged care facilities, people I work with in sport and in business, and they're asking a very simple question, which I think is tough for the Minister and Government at this stage and for all members of Parliament, but it's how to actually form a single voice of truth in the way we did in the bushfires. So in the bushfires, we had a very simple method, particularly in the States, where the Rural Fire Service Chief, Shane Fitzsimmons, was a single source of truth for all of the information about the fires. And all communities in New South Wales, and I think it was the same in other states, were able to rely on that information. We had apps available that told us whether we were at risk or not. There was an amplification of information for all of us, and we could act accordingly.
So, Sam Mostyn, does that mean the politicians stepping to the side of this and letting the medical experts deliver this information? What do you mean when you say this?
Well, I wonder whether that isn't the case, that in the absence of there being a single source of truth, Norman Swan has become that voice for many people. And so when I talk to people, they say, Norman said to do this, or Dr. Swan said to do this. And he's become a de facto trusted source of news, which is unfortunate in the context of a government that doesn't want to do the right thing.
To be fair, though, he's not elected, he's not answerable to the people, and the politicians are.
So my point would be, in the same way that in the fires, you had the head of the RFSs standing front and centre, surrounded by experts and politicians to one side, perhaps this is exactly the same kind of case where you put front and centre the single source of truth that actually can give us very difficult information, can give us the discipline we need, the rules we need as to how we're going to behave, do it in an encouraging way, but a very honest and forthright way, that we've entered a period where there are rules and our personal liberties are actually something we have to give up for a while. And I think politicians probably have to work too hard at smoothing that message to make us feel better, whereas right now what we need is an absolute source of truth and to be told what to do. And it's for, we hope, a relatively short period of time. And if we all play by the rules, as communities in our near neighbours, Singapore, Taiwan, Hong Kong, Malaysia have all done, that's the way we'll flatten the curve, is to have as much information in real time delivered to us so we know what to do and can support each other and put the collective need of Australia right now ahead of our personal liberties.
And that's why we've had Professor Brendan Murphy making statements every day, yes, with the Prime Minister, because that group, the Age PPC, the group that he chairs and works with as in the context of being the specialists to provide advice to government, that's why he's been there every day to undertake that role. And it's unfortunate that we've had some other voices that have split off from that process, which I agree has confused the message. There's no question that's what's happened. But that's why Brendan Murphy has been there every day, so that he can, in the same way that we did during the fires, have somebody who has access to all the information that's required and can then be part of transmitting that to the Australian community. And I think that's a very, very important point.
OK, our next question tonight comes from Miles Proust, who is here.
Attorney General Christian Porter's comments last week that casual workers should have already made provisions for unpaid leave shows a lack of understanding about the reality of insecure work. My question is, what will the government do to protect the more than 2 million casual workers, when many cannot afford to take 2 weeks off.
Before we go to the panel here, Sam Mostyn, is this the responsibility of government, or is this something that business should be playing a part in as well?
Well, I think business has already started to show, Hamish, that we step in and give assurances to our employees when we can, particularly in big businesses. And you've seen global businesses with presence in Australia, like Nike and Apple, that are closing their stores, that are guaranteeing that they're going to pay the rates of their casual and full-time employees and making it quite clear at the very beginning. So I think we've got a joint project here. And the package that we saw come out last week, the $17 billion, does a lot of good work in putting money into the economy to try to help with those that will be most affected by the shutdown effectively. But it does leave a huge number of people, probably 40% of the population, who are in casualised, insecure work, who don't have any guaranteed rights, left with not knowing where they're going to get their money in the next few weeks.
Sure, but it is, but you talk to any casual worker, any contractor in the land, and they're talking about jobs being cancelled right now, Sam Mostyn.
Yes.
So is it only the responsibility of government or actually the bigger businesses in the market? You've talked about some very big multinationals, but there are some pretty significant Australian companies that clearly are putting off casual workers and contractors.
That's true, and there is a range of businesses we're talking about, and I actually think the most vulnerable that are sitting in our economy at the moment are in the small to medium-sized businesses. They're sole traders, they're small businesses that have to let go of casuals and people that they would love to give part-time work to. And that's a vast number of people across the economy. And I think the way we deal with that is not just with government, but it's a collaborative effort with employers of all levels, and then a very clear signalling, perhaps in the package that's coming to augment the existing package that was announced, to put special emphasis on our most vulnerable workers, the most needing workers that are in either the gig economy, the insecure economy. And to the Minister's point earlier, many of those workers are inside the very systems that are actually holding us up at the moment with the human support for aged care, for disability care, and our hospital systems. So they're very vulnerable, and if they come down with any form of the virus and have to isolate themselves, again, I'm not sure they have confidence about where the money will come for them in the intervening period.
Katy Gallagher, given all the financial pressures facing a government at a moment like this, how do you factor in those kinds of concerns?
Well, again, I think the government has a number of jobs on its plate. One of them is to make sure people are kept in jobs. And, you know, if you listen, that was a test the Prime Minister set himself last week with the stimulus package when he said, you know, he wants to see jobs maintained, businesses not fold and the downturn avoided as much as possible.
But specifically on the casual workers.
So, yeah, on the casuals, look, we said last week, and we have come to all of the issues around the government's handling of coronavirus from a position of bipartisanship. That's where we start. We want to work with the government and support it. Where we think they could do more or they haven't done enough or they could improve it, we'll make those points. But fundamentally, we are there to work in the interests of the country. In terms of casuals, we did say last week we didn't think the package did enough for casuals to simply say that if they were required to go in home isolation or they actually contracted the virus, that they could apply for essentially New Start. We didn't think was enough to give them the incentive not to go to work because they're the decisions people are going to make. Can I put food on the table, pay my rent, give my kids whatever they need, or am I too sick to go to work?
But what are you saying the assistance should be for sole traders, for example?
Well, I think, so the gaps. I think there was some gaps around sole traders, around casuals. Look, I think there are some proposals on the table about where you could kick in leave at people's rate of pay so that there is that incentive to go, and the government's got to look at it. I mean, the government has been elected to manage these issues on behalf of the country. So I'm not sure it's up to everybody else to think of what the solutions are. They've got the advisors, they've got the public service, they've got the data, they know what's happening. Obviously, their package of last week isn't big enough because they're rapidly trying to work out a phase 2, and presumably that might come to the Parliament next week for passage. But this is the government's responsibility. It's a test they have set themselves and they have to manage it. And casual sole traders need to be part of their consideration.
Senator Colbeck.
Yeah, well, I think that's right. So there was the initial work that was done as part of the package that we released the other week.
Sure.
Thursday.
But if you think that's right, what should the answer be?
Well, and I agree with Sam as well. it's not just government that's going to have to manage this.
But
it's
if government has a role, what is it?
Yes, they do.
And so we continue to talk to both industry unions, as we did last week with the aged care sector forum that I chaired, to make sure that we provide for, or to hear their ideas, what they were bringing to the table with respect to managing particularly people who are put off around or couldn't come to work because of COVID-19. And some businesses can manage that and are doing that. In fact, Baptist Care in Sydney, who've got a number of...
With respect, we know there's lots of talks. What do you think the government should do to support casual workers beyond saying that there's casual loading factored into the pay that they already receive?
Well, what Christian said was true, but I know that people spend to their income, and so whether they've done what he said they should do is a completely separate question. So I understand where you're coming from.
I don't think they saved for a pandemic, frankly.
No, I'm not saying that they did. I'm not saying that they did. But
over 3 million people.
What Christian said was actually true. But I know that people spend to their income. So
I'm just interested in giving people some answers.
So what we need.
Hamish.
So the government won't be able to manage all of this on its own. It's quite clear that that's the case. Government won't be able to manage all of this on its own. We're going to have to put in place some measures to assist, to support people as we work our way through this pandemic.
But that's the question.
That's why we're having
And
the
when?
discussions that we're having with industry and the unions and workers.
So we've made an initial decision on that.
We've
People
made
are
an
losing jobs
initial
now, that's the
decision
issue.
with respect to that. And businesses are making different decisions. And this is going to be extremely difficult for us all.
Okay.
So talking to
Hamish,
sport today, they're seeing a whole range of issues coming through because of changes that might come through the sport portfolio as well. So this is going to work across the entire economy. It's going to continue to evolve, and we're going to have to continue looking at what we're doing.
Let's take our next question tonight from Stephen Bishop.
Hi everybody, thanks for the opportunity to ask a question tonight. With an otherwise fit and healthy 40-year-old close family member currently in ICU being treated for coronavirus, I'm sadly experiencing the full brunt of this situation. My question tonight is, should the government have been more proactive about preparing Australians for this crisis to hit, particularly in the form of an advertising campaign, which has seemingly come a little bit too late? Does advertising the reality of the situation diminish or increase the panic, but prepare us better to face what's inevitably coming?
Dr. Mukesh.
Look, it's been a very difficult situation, and as we've heard, has been evolving very quickly. My fear is that it has come a bit late, the advertising campaign. I think the information that we've had has been, at the beginning, quite bitty. We're getting some coalition now with the new coalition of the Cabinet of National Unity, which is really something we've got to get to. This is
to put it very simply, though, has the absence of public information en masse like that damaged our response?
Look, I think the level of fear has gone up. I go to speak to many people, through media and so on, take callbacks, and this is a very genuine fear that we have from people that we've heard already, and in terms of their own general health. Your own case of having someone in ICU at 40, not 50 or 60 or 70, shows the point that everybody can get this. And when they do get it, then it gets quite disastrous. And that's why we need to avoid the peak of people getting to hospital bed and needing to have ICU. And the repercussions on you who asked the question, your family and everybody who's been in contact with you, immediately becomes massive.
But the fact that people in the community still don't really seem to understand social distancing, is that a problem?
Yes, and the issue is that there's been a bit of armchair critical assessment of this. There's been a group of people saying we're just being far too draconian about this. What are we doing? Why are we doing more? We should be doing more. And others saying, what's the fuss about? It's not that dangerous. And what we've found is that that has tracked to a place now where we absolutely understand that we're going to start shutting down multiple events every single day because it now has become that dangerous. And that's why we get into panic, because people haven't heard, well, if you do the right things, if you do stay away from other people, have your social distancing, if you do the simple things about social hygiene, your own hygiene, about making sure that you, keep well, eat healthy, do a bit of exercise, you can reduce your load, and then you can not panic so much. And when you do get sick, it starts off like any other cold or flu. You don't know what it's going to be. You don't need to get a COVID test. My colleague on the Sunshine Coast, who had 144 people through his COVID-specific clinic, only tested 23. And people always ask me, how many tests have you done? And I will say, that's not the question. The question is, how many have I not done? Because me and my team of GPs that are in the workplace are saying, we'll talk to the people on phone. We can now do it by phone, thank you, and video, thank you. That's a really big change from Friday. We can diffuse the situation. But yes, if we'd had coming on the back of an advertising campaign about that, or some other good, solid, continuous one hymn sheet, one song, we might have had a better chance of getting to this.
Senator Colbeck, the first confirmed case in Australia was January 25. The first death in Australia was March 1. Why hasn't it taken until this weekend for there to be a national public awareness campaign rolled out?
But there has been a consistent message.
But that's not the question.
Well,
I think so.
but that's the point, I think, that sits behind this. There has been a consistent message all the way through from Brendan Murphy.
With respect, that's not the question. It's about this public awareness campaign, which you rolled out this weekend. Why has it taken 8 weeks since the first case was reported in Australia, when in January during the bushfires, it took 3 hours and 15 minutes to put out a video after the government decided to send in the military?
So we've all the way through been working with Professor Murphy, the CMO, and the advisors to government. It hasn't necessarily been government making the decisions it's been supported by the AHPPC and the medical advice, and that's what we've been acting on all the way through.
Are you saying the advice was not to put out a public information campaign?
And so we have been using Brendan Murphy at the front with the Prime Minister every day, all the way through this process with a message, and it's been a very consistent message. It's been about personal hygiene. How do you catch the disease?
Publish that advice, Senator.
But it's not Professor Murphy who would be designing the public information campaign. Sure, it would be based on his advice, but it would be other areas of government. I mean, it's been too late, Hamish. It's been too late, and now the government is having to deal, everyone is having to deal with the level of anxiety and fear in the community that could have and should have been dealt with better by earlier access to information so that you build trust. If you don't have trust, then you've got real problems. And I think that's where we're seeing the supermarkets raided and people not understanding exactly what they're trying to avoid. I mean, for people who don't actually deal with the hospital or health system all the time, they're not sort of across all of the issues about what the problem is, and that is flattening the curve. I think people are getting across that now. But I think there was a genuine level of anxiety about what it means for me, what it means for my family, as opposed to let's try and slow the spread of the disease down so that we have the hospital resources available to deal with it. And
but I have to
that
say,
could have been helped.
That has been a message all the way through. I mean, I have listened to the Prime Minister and I've listened to Brendan Murphy all the way through. The discussion about slowing the rate of access of the disease into the Australian community has been part of the message all the way through.
With respect, Senator, this is a question about the absence of a public information campaign that was rolled out this weekend. Why did it not happen sooner?
Well, that's been a progression of the disease. And then the decisions of government that have supported that process.
Do you accept what Dr Mukesh said, that this has actually made it harder, the fact that it's taken so long?
Well, I can't argue with Mukesh. He's a health professional and I'm not a health professional and I don't pretend to be. That's not my role. My role has been, particularly within my portfolio area, to act on the advice that I've been given by the health professionals, particularly the CMO and the team that have been supporting him, and that's exactly what I've done.
Sam Mostyn.
Yeah, Hamish, first of all, Stephen's story is tragic and I feel terribly for him to have someone as young as he's had as a family member in an ICU, as others have said. And this is not a black swan event. This is not unexpected. Minister Dutton in August of last year posited the idea of a pandemic through influenza and talked about the fact that it would cause mass death and economic ruin across the world should it come to pass. Now, some parts of our community and our society, when they hear those things, start to go off and do wargaming or scenario planning. Certainly our regulators require that of all of the larger financial institutions to make sure you're prepared for what is about to come. And if it doesn't come, at least you've done the preparatory work. That includes how you're going to communicate to those that most need to understand what's coming and what's going to be required of them as members of the community. And I do think we waited a long time. We did some very good things straight up. When we closed the borders to China and we actually had people going to Christmas Island, I think the Australian public were quite shocked. But they heard that message, they pushed back a bit. There was quite a bit of debate about it, but there was absolute clarity at that point that we had to close our borders. And something happened that doesn't happen in other parts of our community, but it happens in government. That once people got comfortable with that and then we felt comfortable, we lessened our vigilance about what still had to happen. And we watched with almost incredulity the level of activity going on in the countries nearest to us as if that was something that just Asia does or that those cultures do. But in fact, they were following through day by day, hour by hour, and they had a communication plan with their communities that was tough but discipline-based, telling that community what they had to do and telling them what rights they had to give up. They had to stay indoors, not be at their jobs, the massive hygiene campaigns. And we see what happens when they've come out of it. We kind of relaxed at some point where we felt we'd done the closing of the borders and then we started letting lots of people in, the Italians for the Grand Prix. We had people on watch lists, but we then as a community weren't told what's now going to come because we'd seen the incidence of the disease arriving, that now we had to get ready for the next wave. And that's where I think in business we had a plan. So the businesses I'm part of 2 weeks ago started to separate teams so that there were dual teams, so that if one part of the team gets sick, it doesn't influence the business. Boards haven't been meeting face-to-face for the last 10 days in order to preserve the health and the lack of transmission in those boardrooms. That's because there's a plan and a scenario testing that was done ahead of this impact that's coming. So we are where we are. It's a terrible situation. We're at the centre of a massive crisis that's about to take off exponentially again. And all I'd say is we need to get a single source of truth out to the community, simple messages, but realise that we've got to start giving up some individual freedoms for the benefit of the community. And I think we're up for that. We saw that in the fires as communities rallied to support those that were so terribly affected. And we should never forget that we came into this period with the coronavirus already weakened and anxious and grief-struck by the devastating period of time we'd had, not just the fires, but the lead up to the fires with drought and water shortages, and then after the fires, floods, storms, hail, and we've still got cyclones to come. So we've got a really nervous, anxious community that just needs really straight talking, needs someone telling them from a single source of truth what we do now, and we're in the crisis part of this. And I think Australians are up for that, and we want to act in the public good and the common good. And so I just encourage us to look forward. There's a National Cabinet. Perhaps the National Cabinet could do what business does and lay down the politics and have a cabinet that actually comprises leading members of the opposition, maybe some business leaders, in addition to the business liaison unit that's going and reaching out for some sort of advice and counsel from those that are the big employers, those that understand what's happening in small business, medium business, casualised labour. But we need to do something quite different and be creative and bold to get a hold of this so we can save lives and flatten that curve.
Katy Gallagher, would you lay down arms? Would Labor join a national cabinet?
Well, I think our leader, Anthony Albanese, has reached out to the Prime Minister. He's certainly written to him, offering bipartisan support, trying to engage ahead of time.
Do you think that's a sensible suggestion?
From memory, Albo did that and made that suggestion around the bushfires about being involved in some of the decision-making, and Mr Morrison at the time didn't want to engage at that level. The National Cabinet is essentially COAG. That's what it is, just rebadged. With the chief health officers, so that doesn't involve the opposition. But, we have come every step of the way. There's discussions going on constantly about how we can support, Australia to get through this, not based on my political party or their political party. And I think on every measure the government has put forward through the stimulus and through their health response, we have supported. We have said, yes, there are areas we reckon it could be improved or strengthened. We've tried to engage, and we will continue to do that, because we're not just going to be a tick to the government where we think they have fallen short or they could improve it. We will continue to raise it.
This is a question about whether you should be part of it for a brief period of time while we're going through this crisis.
Well, that's probably above my pay grade, I have to say, Hamish, but based on the approach that Anthony has taken, essentially he has been reaching out across the table on every one of these issues. It's up to the government whether they accept us, but Labor stands ready to do whatever we need to do. This is not a political matter. This is about saving lives.
Bill Bowtell, I know you've got a view about this because of your experience during the HIV/AIDS crisis.
Well, at that time, the last time there was a big viral attack on Australia, the leaders of the day, Mr Hawke and Mr Peacock, understood the need for immediate coming together to depoliticise the argument. They said that the federal government should convene all the experts. They would fund whatever it took. They would not politicise it, and then they got off the stage. And the people who then ran the response to that were eminent experts from across the field of virology, epidemiology and public communication. There was no politicisation. There was no political party brawling in the parliament. And it worked very well. We saved tens of thousands of lives and hundreds of thousands of unnecessary infections, unlike in the United States, for example. That was the model. We used to be a leader in this field. The principles laid down at that time are the principles that ought to have been followed now and were rejected. Now, in times to come, we can figure out how and why that was so. But I would think if you went to Italy, to the Italian officials 4 and 5 weeks ago, when there was virtually no coronavirus infection in that country, and they similarly didn't think it could happen here, that it would take its time, I think if you went to them now and said, "Did you do enough?" they would say no. And they would tell our leaders, "Do not do what we failed to do." That is the lesson we have to learn from 4 weeks ago. We are facing this week people who don't know where their next paycheck is coming from. We've faced the collapse of the tourism industry. We've faced the collapse of the domestic travel industry, the entertainment industry. This is serious business. We have to take decisions in the next hours and days, not weeks and months. The time for that argument was sometime in January.
Okay.
We are facing on the verge of a serious national calamity. The fierce urgency of now, tonight, is to correct all the things that have not been done and to really take effective action to persuade the people to basically isolate themselves until we can figure out what is going on and what to do.
All right. Our next question.
That's the challenge of Monday night.
Let's take our next question. It comes via Skype and it's from Christina Posselt in Hocking in WA.
I have my 10-year-old son, Stephen, sitting with me. He has cystic fibrosis, a cruel respiratory illness. Obviously, we're concerned, with the coronavirus and the effect that could have possibly on him.
Obviously, his condition is something that you'd be worried about in normal circumstances. How much have things changed for you as a family?
Oh, it's changed a lot. We're having to restrict, our outings. He races BMX, so obviously we're very cautious of contact with other people and the possible risk of him catching it from somebody else and the consequences of being in hospital, because he can go into hospital at very short notice as it is.
And what's the reality for your son if someone in the family or in close quarters contracts coronavirus?
We would have to isolate. It's extremely serious, and there's the possibility that, if he was to get it from us, that he might not survive.
Do you think Australians understand that reality at this point?
No, I don't think they understand the seriousness for these particularly vulnerable Australians, and they're predominantly young Australians.
And why is it so important for you tonight to come on and ask this question and put your case to the government and to the public?
To prioritise, to ensure that we've got access to products and services.
I mean, it's an extraordinary situation clearly facing many Australians. We've had so many questions from people in different but similar sorts of circumstances. Can you say anything to families like this that are clearly terrified right now, Senator?
Well, clearly this family would be more aware than most other people in the community of the potential impacts on their circumstance, because they are in a situation where they have to practice a lot of the things that we're saying to the Australian community now that you should do. They've already talked about the fact that given what's happening, they need to socially isolate more, because they know directly, because of the fact that their son has cystic fibrosis, what the potential impacts are. They're in perhaps a unique situation in that circumstance. And again, that's one of the reasons that we want to try and minimise the impact on the broader health system, so that the health system remains there and available for their son in the circumstance that he has a need for it. And that's one of the whole purposes that we've been following the advice that we have.
Is there any way to rectify the uncertainty? I mean, that's what we hear from so many people. They just can't get answers. They try all the different authorities at state, local, federal level, and they just can't get an answer about whether their child or themselves will be looked after.
Well, the whole point of what we've been trying to do is to, as we've said a number of times tonight, reduce the rate at which this disease works its way through the Australian community, so that we can make sure that those who do contract it can be looked after, but so that the services remain available for everybody else. It's one of the things that we talked about at the forum that we held for the aged care sector the week before last. We're largely talking about the same workforce. When we're talking about workforce need, it's the same workforce that we might need as a surge workforce right across the entire health sector, whether it be in residential aged care, home care, or the acute health system. It's going to be the same workforce that we're looking to step up. That's why managing that workforce, making sure it has some capacity and availability, is going to be extremely important. That's why we're putting some resources into ensuring that's the case. If an aged care facility has a circumstance like occurred in Sydney, we can put additional people in there to cover off for the people who can't come to work because they've contracted the disease and need to self-isolate because of that circumstance. They're the sorts of things that we're trying to achieve.
But Sam Mostyn.
Sorry to interrupt, Minister. I think Christina and her family presents us with the perfect moment that we've all got to sit and rest with. If we can't support the most vulnerable in our community through this time, we've all failed. And that's why I think we've got to keep thinking about what is the common good and how do we support the common good. And one of the ways we can do that is to think very creatively and differently about the situations of the most needy that will teach us about what we can do across the entire society. So if I think about the disability services sector and the world that Christina lives in, my family has lived in and dear friends have lived in, we need to be conscious of the fact that right now we've got an NDIS with $22 billion guaranteed that needs to be opened up and made flexible and work well for those that need a bit of creativity and a bit more flexibility to actually pivot quickly to get support, so that parents might be able to get payments where, under the very strict rules at the moment, someone sitting in the NDIS service area will have to go through a whole lot of paperwork that will take forever. And yet we know there's good money. We know there are great organisations like Higher Up and other community-based organisations that desperately want to help, want to use new technologies, AI, flexible ways of working with people in the disability sector. They just need to be given the chance to do that with the money that's available creatively. And I think about all these people who are being isolated at the moment, the casual workers who aren't at work, who might actually be paid to get some low-skilled skills that they could then take back into these sectors as part of that surge workforce, get paid, get new skills, and actually relieve the pressure that's on the front line for families like Christina's and those that are in the aged care sector. And we've got so many people of goodwill who can be trained, be part of that, and a fund that's not even part of the $17 billion or the money to come that sits waiting, ready to be used creatively. So I'd really encourage government working alongside those in the sector to think this is the time when Australians can be innovative, creative and seek to serve the needs of the most vulnerable, because then we know that we'll actually be working with a system that could serve us all very well. And that's my test for whether we're going to operate as really great Australians through this and be innovative and use what's right before us and be gentle about this. Rather than thinking everyone's going to rort the system, start with trust and open things up to make things happen very quickly, so that Christina and other families around the country are not living with this fear and anxiety about what might happen.
OK. Well, our next question tonight is from in the audience. It's from Alessandro Gio.
Yeah, thank you very much. So, most European countries are adopting severe measures to contain the widespread of coronavirus. The only exception is the UK, where Boris Johnson strategizes to develop herd immunity over a long period of months, arguing that lockdowns are ineffective. Which strategy do you believe is most effective, in particular in the Australian context?
Let me put this to you, Bill Bowtell. This is something that's come up a lot. This question of herd immunity, enormously controversial.
Well, it's extremely controversial because it makes a set of assumptions that are not scientifically evident. Coronavirus is a novel new infection. Nobody is immune to it. There is no immunity like there is to influenza. So the choice you have, do you stop the infections or contain them in advance of them spreading in the community, as was the case in Taiwan and Korea and Singapore and so on? Or do you wait and do very little and then have a massive engulfment, as we've seen in Italy and France and now Spain and the United States, it has to be said? Or, apparently, in the United Kingdom, do you adopt another policy based on unproven, untested assumptions and effectively make a scientific experiment of your citizens and see how far a virus can spread and see what happens? It seems to me to be an extraordinarily reckless thing to do when we have to hand the tools that obviously work in Asia to make sure that we don't get the problem much in the first place. Now, I would like to know, really, frankly, if the policies promoted by Prime Minister Johnson and his team have been discussed in Australia in the last months, and whether, in fact, we are now living in a country that has more or less adopted the strategies of the herd immunity principle. It would seem to me to be consistent with the failure to plan ahead, to have testing kits, to not worry about social distancing, and to not take any effective measures of the sorts that have been taken in Taiwan and so on, to educate, inform or prevent the spread of the virus in Australia.
Dr Mukesh,
I'm genuinely interested.
This has obviously come up as well in the conversation about schools and whether they should remain open or shut. I heard the Victorian Chief Medical Officer talking about this idea of herd immunity and that children don't seem to suffer this illness as badly as others. What's your view?
I think that the so-called herd immunity is a cop-out and it stops people taking the right decision, which might be a strong decision. I think that there's two different things about what happens in schools. One is nobody's going to get herd immunity in the schools because there's nobody got the infection, as Bill's just said, and there's no vaccination, so they're not going to get immunity. What you're hoping is the kids won't get sick. And if they stay at home, if they do get sick and go home, the concern is they'll have problems with their grandparents. So that's kind of why you want to potentially keep them in school. But there will come a time when that's no longer tenable. I think we have done things here. We have got states setting up testing centres. And I think that what my organisations are doing is getting all the clinical people working in all the major hospitals together tonight, actually, before coming here, to actually bring some more rigour to the way in which the clinical response is marshalled throughout our hospitals. The woeful disconnect between the people working in the community and working in hospitals and the way that's organised is something that's also being addressed by a different group, because that we need to have a joined-up response. You can't separate people because they're working in the community or working in the hospital. We're working in the state or nationally.
Just to be clear, because we're getting lots of tweets about this while we're on air tonight, do you think schools should be closed?
I think we're at the point where that will become a decision. It's not for me to make that kind of decision, but I think you'll hear more and more as this start to peak, that will become necessary, whether it's this week, and we've heard about the AFL going to play 4 rounds before they stop and only do 1 round. I don't think we're going to get to 4 rounds, to be honest.
Okay.
Hamish, can I just ask, I don't want to say that I know anything about herd and the virus, and I would always defer to the experts, but one of the points that Mukesh made about not infecting grandparents is a really important one. So we're close to school holidays. If kids could get home and be isolated, we've got to remember that in this country, grandparents provide childcare worth $4.4 billion a year. And in 2017, almost 865,000 children were cared for by a grandparent who was giving an average of 10 hours a week to look after those young people unpaid. If we have children that get the virus and then infect those grandparents, We haven't even begun to think about what the cost of that unpaid labour for childcare would look like. So we need to protect that as much as we need to protect and flatten the curve and actually do the hard work now to protect as many people as possible. But grandparents are doing a lot of heavy lifting in our economy, and we should never forget that.
All right. Well, we are going to have to leave it there, unfortunately. That's all we've got time for tonight. Thanks very much to our panel, Richard Colbeck, Katy Gallagher, Dr Mukesh Haikerwal, Sam Mostyn, and to Bill Bowtell as well. As things change over the coming months, we want to simply say to you tonight that we will be here, whatever form that takes. Tell us who you want to hear from next week. We know we've only just begun to answer some of your questions. We'll line up all of the experts that you want, the economists, the political leaders, so that you can have a chance to get the answers that you need. Take care, wash your hands, and good night.